A 22-year-old college student is brought to the emergency room by his parents because he has been behaving unusually for the last 6 months. His parents report he has been having frequent angry outbursts and tends to spend much more time alone in his room while at home. Upon questioning, the patient reports that he has spent more time alone recently because the FBI is spying on him and he is not sure who he can trust. This patient could likely benefit from a medication that primarily acts on receptors for which neurotransmitter. The correct answer is B, dopamine. This patient is likely to be diagnosed with schizophrenia. Classic antipsychotics, neuroleptics, act mainly on dopamine receptors. Atypical antipsychotics act on both 5-HT and dopamine receptors. A 32-year-old man presents to the emergency room with headache, palpitations, sweating, and anxiety for the past 30 minutes. His blood pressure is 220/110. Upon questioning, the patient reports that he has experienced similar episodes intermittently over the last year, with complete resolution of symptoms between episodes. Further testing in this patient will most likely show which of the following. The correct answer is D, elevated plasma-free metanephrine. This patient likely has a pheochromocytoma. The classical presentation is paroxysmal hypertension associated with the triad of headaches, sweating, and palpitation. The best test for confirming pheochromocytoma is a finding of elevated plasma-free metanephrine. The most practical and best confirmatory test for pheochromocytoma is urine VMA assessment. A 25-year-old man presents to the emergency department with fever, jaundice, and pain localized to the right upper quadrant. Subsequent endoscopic retrograde cholangiopancreatography ERCP findings show alternating strictures and dilation of the bile ducts with a characteristic beading appearance. Both intrahepatic and extrahepatic bile ducts are involved. What is the most likely diagnosis? The correct answer is C, primary sclerosing cholangitis. Primary sclerosing cholangitis, PSC, is a chronic idiopathic disorder involving inflammation and fibrosis of both intra- and extrahepatic bile ducts. Alternating dilation and stricture of bile ducts results in characteristic beading appearance on ERCP. Up to 70% of patients with PSC suffer from ulcerative colitis.